Good morning, everyone. My name is Eddie De La Torre, and my project is on the nurse practitioner. There's a word that describes what an NP does: practitionering. It represents the humanistic approach to caring for the whole person. Nurses have a long history of specializing in treating the patient as a unique individual, spending time with the patient to understand their needs beyond the diagnosis. The reason NP's approach is so different is due to the framework of knowledge being built on empathy. Nurse practitioners can specialize in 5 different areas across lifespan, from pediatrics to gerontology. They're found in nearly every setting, from hospitals to rural health clinics. According to UNESCO, the route of nurses stepping up to provide primary care began in the late 1800s, where nurses provided impoverished immigrants of New York treatment for common illnesses and emergencies. Today, there are more than 355,000 licensed NPs in the US. According to Liu et al., NPs provide about 2 million visits annually, or nearly 20% of all primary care visits. NP patients have similar clinical outcomes to their physician counterparts, while patients utilize less services, including hospitalization. The NP role is commonly regarded as an advanced practice nurse, and according to UNESCO, the APN and ANP are interchangeable. Both APN and ANP reflect nurses who hold advanced degrees in nursing and influence health care outcomes. Nurse practitioners are one of 4 roles that an APRN can become, the other 3 being certified nurse midwife, certified registered nurse anesthetist, and clinical nurse specialist. Each APRNs hold a minimum of master's degree and specialize in at least one population, those being family lifespan, adult gerontology, neonatal pediatrics, women's health, gender, and psychiatric mental health. NPs differentiate themselves from other APRNs in that they are directly involved in patient care, specializing in psych mental health, acute care, neonatal, or primary care. Unless you were told, it would be difficult to differentiate an NP and a physician as a provider of healthcare. Both assess patients, order labs, diagnose, and educate their patients. According to Liu et al., when NPs are compared to physicians, they have similar costs, outcomes, while reducing visits. If that is the case, it's only a matter of time until NPs have full scope of practice. Timmons et al. Projects that if NPs had full scope of practice in New York, Medicaid patients would have 0.2 more care days annually. The consensus model for APRN regulation was created to reduce role confusion among healthcare providers and regulators. According to UNESCO, this consensus model addresses licensure, accreditation, certification, and education of APRNs. For NPs, the consensus model outlines that they complete a graduate level program within their population foci, pass a national exam, hold an APRN license, and are then allowed to practice independently, including prescribing without a physician. The report by APRN Joint Dialogue Group is clear that it intended for the APRN to be a nurse whose experience is fundamental to the AP role. Part of the criticism of the NPs is that they have insufficient experience. I believe it's likely that future updates will create minimum hours of experience needed to practice with full autonomy. Today, the consensus model has been partially adopted by the states and will continue to be referenced until full adoption. For now, a minimum of master's degree with a population foci is needed, although there is pressure to move NP programs to doctorate levels. In 2021, deans across the country adopted the Essentials Core Competencies for Professional Nurse Education. The Essentials have created a standard that graduates are able to apply nursing concepts consistently. There are 8 concepts of nursing practice across 10 domains. The National Organization of Nurse Practitioner Faculties competencies are specific to NPs and include scientific foundation, leadership, quality, practice inquiry, technology and information literacy, policy, healthcare delivery systems, ethics, and independent practice. For regulatory, AANP and ANCC created standard exams for a national examination. The California BRN sets standards of practice and approves licensing and issues furnishing numbers that allow NPs to prescribe medications, while the DEA regulates the ability for NPs to furnish Schedule II controlled substances. The American Association of Nurse Practitioners are leading in regulating NPs, advocating for policy changes, and has its own journal for publications. The American Association of Colleges and Colleges of Nursing are leaders in developing standards for education and practice for RNs and APRNs. National Organization of Nurse Practitioner Faculties are responsible for creating competencies for nurse practitioners and remain leaders in nurse practitioner education. American Nurses Association is one of the oldest organizations advocating for policy changes. For worldview, I decided to choose Orum's theory of self-care deficit nursing theory. It's a nursing framework that helps define the purpose of nursing. SCDNT believes that humans have a desire to take care of themselves, and when they're unable, nurses can help fill that gap until they've recovered. Nurses' goal is to nurture and develop human potential for self-care. Tanaka 2022. I find that this theory best aligns with my values as a nurse, and my goal is to always have SCDNT be my moral compass. Recently, I had a med error. Thankfully, no one was hurt, but I was suspended for it. And while I consider SCDNT as a worldview, I see myself continuing to be honest about my mistakes to patients and employers. If the goal of a nurse is to heal people to a state of normalcy, maintaining high ethical standards mean that nurses will continue to be trusted by the patients. When discussing the idea of Parse's human becoming theory, I found a great article by Helty et al., where Parse's theory reflects the idea of patient-centered care. Care should be individualized and meet the needs of the patient, not just a blanket treatment for everyone who's diagnosed with the same disease. Beliefs reflect what is important in a person's life. Patients have always done what they believe, even when they suffer as a result. The goal of this theory is to combine their current abilities with medical interventions that adapt to their beliefs. In the study by Helty et al., they performed a study on stroke patients and utilized Parse's and Orum's theories. When patients were encouraged with additional education and in-home training, patients were 5.82 times more likely to overcome insomnia compared to the standard treatment. The study was small, but it shows how much more effective we can be when we practice holistic care and meet our patients' individual needs. In conclusion, we learned about practitionering, how nurse practitioners are experts in combining medical science and humanistic approach to health. We learned of the 5 roles NPs can choose from and how they differ from other providers. They're required to have a master's degree, take a national exam, and get licensed by their state. There are 4 major organizations dedicated to maintaining high standards while advancing public health policy. And lastly, we discussed 2 theories that I believe aid in understanding how the NP role emphasizes person-centered care. Now, these are my resources. If you have any questions, go ahead now.